Let's get back to our breaking news that we first told you about at the top of the hour. DPS and the ATF are investigating a suspicious package at the state Supreme Court building. A court spokesperson says that their mailroom received a package that tested positive for homemade explosives. Jade Cunningham is live at the scene. And Jade, what can you tell us?
Hey, good afternoon, Trem. Yeah, so we are here right now at Madison and 15th Avenue. You can see that there is still very much an active situation, all the different law enforcement agencies responding to this situation. You can see that the road is blocked off here at 15th Avenue. In fact, we're hearing that there is a perimeter that's been blocked off, a 1 to 2 block perimeter surrounding the state Supreme Court building that has been closed off. And that also includes the buildings and other businesses that are in close proximity to that. You know, we're hearing the Department of Ed is shut down. The Capitol Center building, which is right next to the state Supreme Court building, that is another business that is closed at this time. Multiple agencies responding to this. We have seen a lot of Phoenix police officers kind of patrolling this area. You can see Phoenix Fire is here as well. They have their command response vehicle set up. The bomb squad, DPS, of course, is here investigating. They've called in ATF, as Tram was saying, to help with their investigation. We are actively working to confirm information at this time. What we know is that a little after 11 o'clock this morning, authorities were called to this building, and according to that state court spokesperson, that suspicious package was received by the mailroom, which tested positive for homemade explosives. The state courts building and surrounding parking lots have since been evacuated. Again, they are closed at this time, and all staff were told to go home. Now, it's unclear how long this closure and how long this scene will last out here at this time. We also know that authorities, they of course are going to have to conduct a full sweep of the building. They also need to safely dispose of that package. You know, the bottom line here is safety. They want to make sure everyone is safe in a situation like this. So we'll keep following this, and you can stay with 12 News for the latest. Reporting live, Jay Cunningham, 12 News.
Jade, I'm wondering, that suspicious package, was it sent to anybody in particular?
At this time, we do not have that information. All we know is that that package was found in the mailroom today that had some materials in it for homemade explosives.
All right. As long as everyone was evacuated, everyone is safe for the time being. Thank you so much, Jade. I know you'll have more coming up later in our shows.
Maduro was the kingpin of a vast criminal network responsible for trafficking colossal amounts of deadly and illicit drugs into the United States. All of these actions were in gross violation of the core principles of American foreign policy, dating back more than 2 centuries. All the way back, it dated to the Monroe Doctrines, and the Monroe Doctrine is a big deal, but we've superseded it by a lot, by a real lot. They now call it the Donroe Document. I don't know. We sort of forgot about it. It was very important, but we forgot about it. We don't forget about it anymore. Under our new national security strategy, American dominance in the Western Hemisphere will never be questioned again.
Several local hospital systems here in our area are seeing this increase as well.
Carolina East Medical.
And several local hospital systems here in our area are seeing this increase as well.
Carolina East Medical Center in New Bern says starting next week, they'll be limiting visitors at the hospital. On your sides, Lauren Beachy has more about how this is keeping patients and staff safe during this surge.
Starting this upcoming Monday, Carolina East Medical Center in New Bern is limiting visitation as a result of the growing spread of respiratory illnesses in the community. Patients are allowed 2 visitors, 12 years and older, during visiting hours.
So our flu numbers are dramatically increasing. Week to week, they're almost doubling. So we are seeing a large number of flu patients. We, at this time last year, had seen about 21, and we've treated over 600 in the last month.
They say by limiting visitors, it's helping to limit the spread. Children are more likely to spread infection, which is why they're restricting them as well.
One of the things that people aren't really aware of is that you're contagious 2 days before you actually get sick, which makes it very, very easy to spread and result in the numbers that we're seeing.
They're recommending people mask up, wash your hands, and it's still not too late to get your flu shot.
So there's a couple of things that are unique this year. One of them is that the virus mutated after the vaccine was developed, so there's a little bit of a mismatch. The vaccine doesn't prevent influenza as well as it could. It does prevent serious illness better. So we still do recommend that you get the flu vaccine.
Hospital officials say there's no end time frame for this limitation of visitors. They'll monitor cases and go by those numbers.
We'll monitor it as we go. We do expect there to be some bumps in influenza related to Christmas and New Year's, so we'll just monitor it as we go.
Carolina East also says they're seeing a low level of COVID and RSV cases. It's all mostly influenza. In New Bern, Lauren Beachy, 9 on your side.
We are seeing a spike in illnesses in the gap between Christmas and New Year's. The North Carolina Department of Health and Human Services is reporting a spike in all respiratory illnesses, but seeing more flu-like cases. This is data from the week of the 17th. It's the latest report released by the state. The doctors say the flu season is here, and it's exceptionally bad this time around. Good evening. This is the Fox 8 5 o'clock news. I'm Michael Hennessy.
And I'm Natalie Wilson. Fox 8's Melissa Rademacher joins us from Cone Health in Greensboro, where, Melissa, it's one of many hospitals limiting certain aged children as visitors to try and protect people already hospitalized, as well as children from spreading the sickness. What else are you hearing?
And it's just that time of the year where the flu is prevalent between those holiday gatherings. It's the start of flu season and people are spending more time inside. But it also has to do with the strain this year. It's particularly strong and it wasn't predicted in this year's vaccine.
I would say even the last week, we've had a significant jump in patients showing up to our emergency rooms for influenza-like illness, as well as our admission rates.
Cone Health doctors say in the past 2 weeks, they've had the number of positive flu tests increase by 25%. Of the total flu cases, 55%, more than half, are pediatric, and most of them are the same strain.
Greater than 3/4 of the circulating strains of flu is that H3N2 subtype, subclade K strain, and that's the one that's not as well matched in our flu vaccine this year.
Dr. Cynthia Snyder says it's the strength of that strain contributing to the number of people catching it, but it's also recommended to get the vaccine.
The vaccine, it may not be as effective as it was last year, but it still prevents severe disease and severe outcome, right? We want to make sure that as many people can get the vaccine in order not only to help themselves, so it prevents, I think the estimate is about 30% decrease for going into the emergency room or getting hospitalized.
To keep those already hospitalized healthy, Cone Health is already asking that children ages 12 and younger don't visit the hospital. Starting tomorrow, Novant Health and Randolph Health are putting similar restrictions into place, also asking people recently exposed to the flu to avoid visiting people in the hospital.
When someone's sick enough to be at the hospital or even recovering from a surgery, you don't want to compound their healing process by also being exposed to flu and possibly getting it.
And it sounds like the obvious things, but Dr. Snyder says it's now the time of year for these reminders. If you do feel sick, try to stay home from going to work or going to school for the kids. If you must go out, mask up if you're feeling any of those symptoms. And it still is not too late to go ahead and get that flu shot to try to stop the general spread of this flu strain. In Greensboro, Melissa Rademacher, Fox 8 News.
Melissa.
What about wearing a mask? I mean, there's lots of controversy about mask wearing. Does it work? Does it not? What do you think, Dr. Zoe?
So we know that masks don't 100% prevent transmission, but what I would say to people, if you are unwell, if you've got cold symptoms or if you think you might potentially have flu symptoms, then you wearing a mask can prevent that spreading to other people. It's not 100%, but if you're not able to stay at home, which some people aren't, they have to get up and go and do their jobs, then wearing a mask can prevent. Also, I think for people who are vulnerable, wearing a mask gives some protection, a little bit of protection, but I think as much as anything, it signals to other people that you're somebody who's trying to protect yourself in some way. So it kind of gives that signal, don't come too close, don't breathe on me, don't talk to me.
Oh, thank you, Dr. Zoe.
Okay, Zoe, thanks for joining us.
Now to the new CDC report showing flu cases surging nationwide. Health officials estimating about 7.5 million cases. 29 states now reporting either very high or high levels of flu activity. New York State reporting cases in record numbers, many linked to a new variant. And tonight, what that means for the current flu vaccine. Here's ABC's Rhiannon Allen.
Tonight, a sharp rise in flu cases raising alarm among medical experts. In just 1 week, according to CDC data, flu-related illnesses jumping more than 60% from 4.6 million to 7.5 million. Hospitalizations also spiking more than 60% from 49,000 to 81,000. And more than 1,200 deaths have been reported. 29 states now reporting very high or high rates of illness, including New York, which just reported its most ever cases in a week. Some schools closing early for the holiday break due to widespread illness.
We had about an hour where the phone was just ringing off the wall and parents calling kids in sick.
CDC data showing last year's child flu deaths reached their highest level since the 2009 swine flu pandemic. Experts say vaccination rates among kids, down 10% compared to before the pandemic, are partially to blame.
The concern is the amount of patients presenting. That can put strain on the hospital system, limit resources, and treating the complications can become even more difficult.
The CDC says the bulk of cases are linked to a new variant called subclade K, which has mutations that appear to have resulted in a mismatch with this year's flu vaccine. Doctors say getting the vaccine will still reduce the risk of severe illness.
With the CDC's data is released on a delay, that means these latest figures are from the week before Christmas, so current flu levels are likely even higher. Whit?
All right, Rhiannon Alley, our thanks to you tonight.
North Carolina health officials issue a measles exposure warning. Here's 3 stories in 1 minute. The North Carolina Department of Health and Human Services confirmed an individual infected with measles traveled through Gaston County on December 26th. Health officials say symptoms can include high fever, red or watery eyes, tiny white spots inside the mouth, and spread of a red rash. Governor Josh Stein celebrates the increase of job opportunities statewide. While visiting a local manufacturing shop in the Triad, Stein highlighted strategies to increase the state's workforce. This includes the expansion of work-based learning and apprenticeship opportunities. A NASCAR development program is on the hunt for driving prospects. The Kawiki Driver Development Program has started its nationwide search for 5 participants this upcoming racing season. The deadline for applications is January 23rd at midnight. For more information, visit our website, abc45.com. North Carolina.
Well, concerns are growing tonight about measles cases in North Carolina. We've just learned that a person with the disease traveled through Gaston County. WCNC Charlotte's Bria Smith spoke with state healthcare leaders who say this problem probably won't be the last exposure, specifically to measles.
2 measles exposures were announced by the North Carolina State Health Department after one individual with the virus stopped at a Gaston County restaurant and visited McAdenville. Right now, healthcare professionals are sharing what you can do to protect yourself.
Somebody just went to concert, then stopped by here for dinner, and then he went to he went to the hospital, and then he said, "Where you been?" And he said, "I've been in concert, I've been in this place, I've been in this place."
The North Carolina Department of Health and Human Services says the individual traveled through Gaston County while infectious, going to Constantine's and Christmastown, USA in McAdenville on December 26th between 5:30 and 8 p.m. The health department is urging others who were in either of these spaces to be aware.
If you were at the Christmas lights show, I would just say watch for symptoms, but we don't believe that there's any significant risk related to that. At the restaurant, that's an enclosed space, so there could be transmission. Measles is a really contagious virus.
Fatih Ongen, the owner of Constantine's Turkish Mediterranean restaurant, says after he was notified of the measles exposure in his restaurant, he and his staff got checked. They were all negative. He says his team continues to make sure everything is cleaned like normal.
We were so picky about our restaurant, about our cleaning, about our health department. So we every day cover our table, change the covers, change those things, and you see the glasses. We are very picky about the cleaning.
NCDHHS Medical Director of Vaccine, Preventable, and Respiratory Diseases, Emma Duran, says the virus shows up with flu-like symptoms, including a rash. She says the vaccine is one of the best ways to be proactive against the disease.
It's incredibly safe and very effective. If you've been vaccinated, there's not a significant risk even being in that same location. Again, worth thinking about what those symptoms are and looking out for them for the next 21 days.
If you're someone who feels you may have been exposed to the virus, contact your primary care as soon as possible. In Gaston County, Bria Smith, WCNC Charlotte.
Across to the other development that we've been tracking very closely, and that comes in from the United States of America and Venezuela. From the presidential palace to a prison transport, Maduro now finds himself in a New York court. The visuals on your screen show Maduro being escorted in cuffs to a Manhattan federal court. Venezuela's deposed leader, along with his wife, were flown from a Brooklyn jail to face U.S. drug trafficking charges, following what Washington described as a dramatic operation leading to his capture. Meanwhile, President Trump has issued a fresh warning to interim president of Venezuela, Mr. Rodriguez, saying the United States will strike again if Venezuela does not fall in line.
The next question is who's in charge of Venezuela right now. Have you spoken to the newly sworn-in president there, Rodriguez? And what are your thoughts on the entire situation? You said the U.S. would run Venezuela.
We're dealing with the people. We're dealing with the people that just got sworn in. And don't ask me who's in charge, because I'll give you an answer and it'll be very controversial.
What does that mean?
We're in charge. This isn't a country that's on the other side of the world. This isn't a country like we have to travel 24 hours in an airplane. This is Venezuela. It's in our area, the Don Road Doctrine.
So is that what you would say, that we're in the business of nation building?
No, we're in the business of having countries around us that are viable and successful, and where the oil is allowed to freely come out, because that's good against the prices down. That's good for our country.
President, if you had to sum up Operation Aspen, so would you say that it was about oil or it was about regime change?
It's about peace on earth.
How is it peace on earth?
Peace on earth. We gotta have peace. It's our hemisphere. The Monroe Doctrine was very important when it was done, and other presidents, a lot of them, they lost sight of it. I didn't lose that. But it really is, it's peace on earth.
Came to the conclusion that I can't give a political campaign my all. Every minute that I spend defending my own political interest would be a minute I can't spend defending the people of Minnesota against the criminals who prey on our generosity and the cynics who want to prey on our differences.
That is Tim Walz dropping his run for a third term as governor in the middle of Minnesota's massive fraud crisis.
Meanwhile, the Trump administration says it is now deploying hundreds more federal agents to the Twin Cities. In an update today, the Department of Homeland Security said it has already made more than 1,000 immigration arrests over the past few weeks. As Jason Rantala reports, with a major surge of federal resources to Minnesota, they're expecting to make fraud busts too.
For more than a month, tense scenes like these have played out across Minnesota. And now the president is doubling down.
And every one of them should be forced to leave this country.
The White House ordering 2,000 more federal agents to the Twin Cities, according to multiple law enforcement officials. Those agents will be tasked with not only tracking down people with deportation orders, Homeland Security investigators are expected to probe alleged cases of fraud, too.
They've stolen from Minnesota and from the United States.
It
is a political theater.
The surge comes amid intense scrutiny targeting the Somali community following years of high-profile fraud cases involving federally funded programs.
We have seen an increase of hostility. We've seen businesses report increased monitoring, but most importantly, increased inquiries into their businesses from different agencies. And we're anticipating obviously more.
It's also really disheartening and really scary to see because we know that families are going to be separated.
UDO is an organizer with the Minnesota Immigrant Rights Action Committee. With the news today that we're expecting 2,000 more federal agents in Minneapolis, how does that change the work that MIRAC does?
We're going to roll out more resources and more ability to be able to serve our community.
By noon of today, we've already been able to confirm over a dozen ICE activity.
Edwin Torres de Santiago with the Immigrant Defense Network says a 30-city tour training constitutional observers launches Tuesday. They're expecting nearly 100 people that first day alone.
Our helpline and our partners are activated right now as we speak.
Jason Rantala, WCCO News.
A head of Border Patrol is expected to arrive in Minnesota soon. He will help lead the immigration enforcement efforts along with an unknown number of Border Patrol personnel.
If you're struggling with depression and not